Test. Hello. Okay, we about ready, everybody? Can kind of let you know the order of events. I'm going to say a few comments, and then Dr. Gerald Menz is here. He's going to address with a few comments. Mayor Whipple's here with a couple of comments, and then Tim Kaufman, who helps run our distribution coordination, he's going to make a few comments. So with that, welcome everybody for being here, and I want to recognize others. Commissioner Howell's here, Commissioner Dennis, Commissioner Cruz, and Commissioner Megan Lovely. Wait, no, that's not. She's not Commissioner. Okay, so anyway, did I miss anybody? I don't think I did. So any council members are not here that I don't see? Okay. Okay, with that, obviously, as you all know, the community, we continue to receive a steady quantity of the vaccine, and then the weather happened, and because of the weather with a lot of things, that shipment stopped this week. But nevertheless, we continue to provide these doses to our residents in a thoughtful and expedient manner. Every dose we have right now is assigned to a person. And so, and as you know, Interest Arena has been an invaluable partner for us in helping launch the clinic, the vaccine clinic. And we appreciate that partnership with Interest. But we don't want to overstay our welcome, and we want to hinder the Interest's ability to start having shows and bringing back the economy. And obviously, if you've been there, you saw how we kind of owned the building, and thanks to AJ and his staff for the tremendous help there. So with that, we are excited and pleased to announce that our vaccine clinic will move to this building, the former Wichita Downtown Library. We'll be doing that on Monday, February 22nd, so it's right around the corner. And there'll be some thanks, but I can't thank the city of Wichita, my former friends there that were, when I was there. Mayor Whipple was really instrumental in helping secure this building. We've done a little bit of work already to prepare it to be the vaccine clinic, because we know now that we're going to be here for foreseeable future, meaning months probably, to get the whole vaccine world going. So with that, Mayor, I can't thank you enough again, and City Manager Bob Layton and the rest of the City Council for supporting this. It's a nice building, and we're bringing it back to life in a different form, but that's where we're at. So with that, I'd like to, it's Dr. Gerald Menz that's next at this time. So, Dr. Menz.
Whomever you want.
Yeah, okay, well, that's all right.
You call it.
I bet a year ago, none of you knew who a Dr. Menz was, but now he's infamous in our community, and I can't thank him enough. His communication with the medical world in our community to help determine what's best. He tries to help balance the economy with the medical security of our region, and we get a lot of criticism here and there, but we have taken steady steps to kind of reopen the economy in a respectful manner. I kind of went off script there, but Dr. Menz, I just can't thank you enough. So thank you with that.
As we said before, this phase of the COVID vaccine schedule, we are first focusing on the vaccine supply for residents by age. At this time, the health department is vaccinating residents 78 years of age and older and healthcare workers. We've already offered vaccine to healthcare workers and those in direct contact with COVID patients. We are pleased to hear Governor Kelly is implementing a vaccination plan to help K through 12 schools open across the state by vaccinating teachers and staff. I'm in full support of getting our children in schools to continue their learning, growth, social interactions, and health and well-being. I look forward in supporting Sedgwick County Health Department and our schools in implementing a vaccination plan for our teachers and staff. As a reminder, the vaccine schedule is a marathon and not a sprint. It is dependent on vaccine supply and the allocations we receive from the state and the vaccine manufacturers. Rest assured that everyone who would like to be vaccinated will be able to eventually receive the vaccine as it becomes more widely available. I'd like to take this time and reiterate how important it is to get the vaccine once you are able. In order for us to get to a place where we can ever consider opening up our community entirely, we must continue to use the tools in our toolbox to keep each other safe and healthy, such as wearing a mask or face covering, washing our hands frequently, watching our distance, and try to keep a 6-foot space between us and others as much as possible. And lastly, I would like to remind everyone that we must continue to follow these behaviors, especially mask wearing, even after receiving the COVID-19 vaccine.
Okay, thank you, Doctor. Just another comment establishing how quickly this thing is moving with the vaccines. You know, within a matter of days and a couple of weeks, we have been able to offer vaccines from age 90 to 83 to 80 to 75 and now to 70. That's been very, very quick for a population of our size. Kind of also note that the state says that 10% of the population has been vaccinated. That's 300,000 out of 3 million. And we believe between what we've done with our county health department and the private sector with the hospitals, we're at about 50,000 vaccines out of 500,000. So we're kind of in line with the consistency of the state. We hope to fly by that and improve. But so with that, talking about vaccine, I want to also I want to recognize Sarah Lopez. Commissioner Lopez just has joined us as well. Hello, Sarah. So with the next speaker will be Tim Kaufman to address the vaccination. Tim.
Thank you, Chairman Meitzner. I'd like to reiterate our thanks to both Interest Bank Arena for the great partnership that we've had there and with the City of Wichita now as we continue to do everything that we can to vaccinate as many people in a quick and safe, effective way. Yesterday, Governor Kelly announced a plan to vaccinate all teachers and staff as part of a strategy to reopen K-12 schools across the state. This is possible because of an increase in vaccine dosage that will be distributed across the state, including here in Sedgwick County. Immediately following that press conference that the governor had, we were eager to discover that Sedgwick County will receive an additional 3,510 doses per week until we reach the point where we've been able to vaccinate all of our school teachers and staff. Shortly after that announcement, Sedgwick County staff had a very productive meeting with 10 different superintendents, the main school districts located in Sedgwick County, including Wichita Public Schools, the Catholic Diocese of Wichita, Hayesville, Derby, Valley Center, Renwick, Goddard, Mays, Cheney, Mulligan, and Andover. We specifically wanted to understand from them their total staffing numbers and then get a good idea of what percentage of their staff were interested in receiving the vaccine at this time. That's going to help the health department and those districts plan vaccine clinics to get their staff vaccinated. A large part of yesterday's discussion included vaccine logistics for each district. We know that each district is configured a little bit differently. All of them have nursing staff, and so we will, over the course of the next week, work with them to make sure that we come up with a plan that suits their staff and their needs, using the resources that they have, community resources and resources that the health department has, to develop plans to make sure that all staff are vaccinated over the next several weeks. We believe that as we develop these plans, we'll be able to get staff vaccinated, at least that first dose, by the end of March, again, meeting the governor's goal. And we'll continue to then follow up with second doses. But again, each of these plans will be configured to meet the needs of the various districts, because we know that they're all a little bit different. Over the course of the next week, we'll also be in contact with all of the other private and parochial schools that may not be part of one of those large districts, but it's our goal to make sure that everyone who works in a school, K through 12 here in our community, has access to vaccine. We're certain that we'll be able to do that with the partnerships that we've developed with the providers and working with the school department, school districts as well. It has always been a goal of the Board of County Commissioners to get teachers and staff back in school safely. And we all know and understand the importance of keeping our kids in school for continuous learning and growth today. So Sedgwick County is pleased to move forward with this phase of the vaccination plan. Chairman?
Thanks, Tim. Talking about how fast things move, you know, I remember that I think it was Friday afternoon, the governor announced that the state was going to get from 40,000 to 90,000 vaccines. So we're all excited Friday afternoon, thinking we're going to get more. And then Monday morning, we get a call that says, due to the weather, you're not getting any this week. So, and then by Thursday, then it's announced that now we go full force into some extra vaccines targeted for the teachers. So it's hard for us to communicate to the public without your help, to just know that this thing is an ever-moving target, and hopefully it's a positive target that's been moving. So, and with that, I want to really recognize again the mayor and the city of Wichita for providing us this building to come to be the vaccinating. So, Mayor Whipple, come up here and say a few words. So thanks again for everything. Okay.
Thank you, Commissioner, and really thank you all for being with us today with the other electeds we have from the County Commission. Dr. Mintz really described this whole situation, I think, well, as a marathon. And from the very beginning of this marathon, it's been the city's role to come alongside the County Commission, who serve as the Board of Health, and to figure out, in that beginning, what can we best do to be good partners in ensuring that our community gets through this pandemic as well as we can. And now we're towards those last few miles of this marathon, and it has taken a lot out of us as a community. But as the chairman said, as we get through these last few miles, we are seeing an increase in vaccinations. We are seeing a decrease in the spread of this throughout our community. And as we see an increase in the supply of vaccinations, we have to look towards our assets as a city, as a community, to discuss what is the best way to get this service to the taxpayers, to the people. And lo and behold, we have this beautiful building. This building that has been sitting here just waiting for an opportunity like this so that folks can come not only see really this historical architecture, but utilize this building in a way that will make sure that our seniors aren't out in the cold waiting in line for a shot. Make sure this is used in a way where we can actually have more appointments with people coming here to get this life-saving vaccine. And in doing that, we as a city feel really just lucky that we are in a community that has this asset, and we are lucky that we have such good friends over at Sedgwick County who we can work side by side with to make sure that we can provide the absolute best experience for folks who are coming in for those vaccines as we complete these last few miles of this pandemic. So with that, Mr. Chairman, thank you for inviting me to this press conference. It's great to be back in this building, and I look forward to hopefully future press conferences where we can announce the decrease and hopefully the eventual, the eventual end of this pandemic and this crisis. Thank you.
I feel like giving you an applause for letting us use this building. So it's a virtual applause. So with that, you've heard from the players here, and we would stand for some questions to any of us are available between Dr. Mintz, the mayor, Tim Kaufman. Yes, ma'am.
You mentioned we are moving into a new phase. Are we still in the second phase? It's just, I guess, figure of speech, or
We're still in phase 2, but if you look in phase 2, there's various groups within phase 2, and basically the teachers have now been accelerated to the top of the phase 2 list. And we're doing it by age, and now we're adding teachers into the next category. Tim, is that pretty accurate? Okay. So there's other categories in phase 2 as well that will be done before we end up going to the phase 3. Yes, ma'am.
So for this teacher phase that we're in now, I know USD 259 has their own kind of system going on. So is it going to be kind of like what we're seeing with them, or are they going to be coming to here to get those vaccines?
As I mentioned, the intent is to match whatever works best with each school district. 259 has a system that they've identified that's going to work for them, and we'll work with each of the rest of the districts and then some of those independent schools as well to figure out what makes sense for them. In some instances, it may make the most sense for them to come to this location. In other instances, we'll work with them and partner and pair health department staff with school district staff to make things happen on site.
So when do you think teachers and school staff will be able to actually sign up for vaccines?
Some of that's going to vary by school district, but I think that probably within the next few days, each of the districts will have a plan in place to do that.
Will teachers be prioritized by age? How will that work?
Again, the districts are going to be making some of those decisions, but as Dr. Mintz has indicated, if you can focus your vaccines initially on folks by age, you're going to do the most to impact hospitalizations and things like that. So it wouldn't surprise me if school districts did something very similar.
so far only 259 received vaccines?
Yes, that's correct, but we'll be working with the rest of the schools to make sure that they have access to vaccine as well. Again, the amount of vaccine that we've received, certainly we'll receive next week, won't be enough to cover all the teachers and school staff across the community. This is going to be a multi-week process, but we'll work with the districts to make sure that all happens.
So I think I heard this correctly, but we actually received no vaccines this week.
That is, we have not received vaccines that would have been scheduled to deliver this week. Pfizer made the decision that they weren't going to ship vaccine with the transportation system as impacted as it was by weather.
So the extra amount for school staff is on top of the roughly 7,000 you've been getting weekly?
Yes, that's correct.
Will this building be able to hold as many people as interest for vaccines? I mean, will it slow that process down a little bit, or I don't know how that'll work here.
We believe that we've got it configured, we'll have it configured in such a way that we'll be able to vaccinate as many folks as we were able to vaccinate at Intrust Bank Arena. First day or two, we may see a little bit slower throughput, but it won't take us long to get that throughput pushed back up.
You know how many weeks you guys were at East Coast? With the clinic?
Like 100?
It did feel like 100. I'm going to say 4 or 5.
I have a question about parking. Will people that park out here to be vaccinated in this building be issued parking citations by the city or county?
We've partnered with the city to make the parking lot that's directly south available. It'll be marked off and designated as parking for folks that will be coming to the vaccine clinic.
So will the transit center still be doing the drive-through option on top of this new option?
Yes.
we do have Ms. Kazis from USD 259. Just, we do have Ms. Kazitz from USD 259, and she'd be available for questions as well. But she did mention, and please nod if I'm getting this right, that USD 259 is actually recognized through the CDC as a vaccination organization, that they can actually give out vaccinations, which makes us different than other school districts. And thank God she's coming up here. Thank you. And of course, while I have the microphone, I got to make a joke about the eagle making a comment about our parking. They're always honest about that.
Thank you, Mayor Whipple. I'm Kimber Kazis, the Director of Health Services for Wichita Public Schools, and I was not planning on talking today. I just wanted to be here for this exciting news. So Wichita Public Schools has worked for several months to become a vaccine provider site. So we have a license number with CDC and with KDHE. We still have been receiving our one allotment of vaccines from Sedgwick County last Friday. Thank you very much. That was amazing. And so we still have some of that left that we'll be giving out at our vaccine clinics this weekend. And people are scheduling as we speak for that. And we have had a distribution plan in place to be ready for this. So our distribution plan is online on our district website if you want to find that. So we are focusing on age. I know someone asked that, and we want to make sure that we're capturing that. Yesterday I sent an email stating age 70 and up and healthcare associated workers. And today I sent out a expanded eligibility to say age 65 and up, healthcare associated workers, and staff that had indicated medical conditions that would place them at high risk if they were to get COVID-19. And so we are only opening appointments for the number of vaccines that we currently have on hand. I took that out of the playbook from Sedgwick County Health Department. You don't schedule for what you don't have, right? So our staff understand that as we receive more vaccines, that's going to be done accordingly to the size of districts, that then we will open up more clinics and more people can sign up. So I'm going to also still that this is a marathon and, not a fast foot race. We need to just stay the course, and we have a plan in place, and we'll move forward with that and follow the directions of Sedgwick County Health Department to make sure that we're staying compliant.
How many vaccines did you administer in the clinic last week?
We've administered 151 of the Moderna vaccine first dose. We have all of those people scheduled for their second dose. So just so you know, when you receive your allotment, you have to make sure that you only vaccinate for half of the allotment for the first dose so that you have the second dose. So we still have first doses available. That's what we'll be using this weekend. And then we will have to wait until we get another allotment in before we can move forward.
Very good. No more questions.
Thank you.
How many employees do you have at the district that are going to eventually need a vaccine?
Well, we have over 9,000 employees, including our sub-teachers. And the survey that we sent out that was out over a month received over 6,800 responses out of 9,000 employees. Of those 6,800 plus responses, over 78% wanted the vaccine. And I feel like that is huge. That is a health-minded, proactive community. So I don't have that number on my brain. It's over 4,800, I can tell you that. And I know more people will, once they find out that it's available, I think a lot of people were unsure and wanted to see what happens in the research.
Any questions about the library?
Let me add too from a data world. Between the USD 259 and the other 9 districts or school systems, we've estimated is it about 12,000 potentially total teachers and staff that would be qualified. And if you do the math, according to the announcement yesterday, we're going to get about 3,500 additional tests vaccines per week. So you can do the math, but that's if 100% of them want it. And a lot of these teachers, some of them have already been vaccinated, but either by age or through their own means of being vaccinated. Some maybe live in other counties that maybe had a chance to. So that's the max. Am I right, Tim? Probably. So, you know, you can determine that. Let's hope, like Tim said, within the next 4 weeks, maybe we get it all done, or maybe the state next week gives us more. Maybe another tornado comes through and we don't get any. I don't know. I mean, it's crazy. But little did you know, when I was on city council, that we cut a ribbon to open up a new library. Did I ever think that this building would be a vaccination center in a temporary? So it's good for our community. Again, thanks everybody. I think that pretty much covers it. Some of us will be around if you want to talk further. So thank you all for covering this.
Hey, was that an order for you guys?